Hi, my name is Dr. Sabah Rizvi with my Dentist for Life here in Plantation, Florida. Today I'm going to be talking about some of the most commonly asked questions regarding dental veneers. Dental veneers are laminates that go over the structure of your teeth, very similar to laminates over cabinets, and they are either bonded or cemented. Some of the most commonly problems that are solved with dental veneers is discoloration. We can fix that. Chipped teeth, worn down teeth, misshapen teeth, or even crooked teeth. Veneers are always going to be permanent. They're never removable. They go over the surfaces of the teeth, and they are either bonded or cemented over your teeth. What you should expect throughout the process of getting veneers is there's a lot of photography because we want to make sure that we are documenting everything from start to finish. That's number one. Number two, we're using a lot of technology because we want to practice in the most optimal way. So we're having a digital scan, digital x-rays, and all of that gets sent out to the Smile Design Lab. And after that, you come in, we do a mock-up. We can show you what your teeth will look like before even starting any of the procedures. So that's pretty cool. We can even show you a digital simulation on the day of your consultation. And then on the day of preparation, it's half a day. We'll go ahead and prepare the teeth, make your temporaries, and then 3 weeks to 4 weeks after the product has come back from the lab, we go ahead, take your temporaries off, and put the permanents on. Veneers will absolutely match the color of your teeth if that's what you're looking for. However, if you're going for a more lighter, more beautiful color, we can customize shades to whatever you want. It's completely customized. We have a whole shade gallery, and you get to choose what color you want. I always get a lot of questions regarding porcelain versus composite veneers. There are pros and cons to both. Porcelain veneers, the pros would be that they are ultimately the most beautiful look that you can achieve. It is designed and customized to however you want, and the longevity of them far outlasts the composite veneers. And we want our veneers to at least last 10 years if taken care of properly and everything is adjusted. The disadvantage of porcelain veneers is cost. It is because it is more technique sensitive. We are sending it out to one of our exclusive labs to make sure we get a beautiful result. So we want to make sure that we are giving you that beautiful smile, so cost is also a factor. Now, as far as composite veneers go, the pros are it's conservative, meaning that it helps retain the integrity of your natural teeth without us having to remove any of your natural teeth structure. So from a holistic level, biological level, composite veneers are a great option if you are not wanting to damage any portions of your teeth. The other advantage is they look very beautiful as well. Because everything is designed digitally, we actually design the composite veneers, making sure that we have the right beautiful smile that fits your face. And it's a one visit procedure, which is nice because all of the veneers on one arch could be done in a single visit rather than any lab, so there are no temporaries. And then obviously the cost is more reasonable compared to the porcelain. The disadvantage of the composite veneers is that because it is a porous material, not unlike porcelain, it does have the chances of staining. So, after about a year, I do recommend that just like we come in for our annual or by like every 6 months cleaning, on one of the cleanings I do recommend a polishing of the composites, which can be done to help enhance the color of their teeth. So how long does it take to place veneers on teeth? It is generally for porcelain, it's a 2-visit procedure. After we gather all the records and data that we need to provide that beautiful smile that you're going for, you'll come in, we'll prepare the teeth, and then we'll send scans of your teeth so the lab can start building that beautiful smile that you're looking for. After about 3 to 4 weeks, you come in, we remove the temporaries, and then we'll cement in the veneers. So it's 2 visits. For composite veneers, after all the data has been gathered, just like with porcelain veneers, it is a 1-visit procedure. And we basically have you come in, we have the template, we inject the composite bonding, we polish, smooth, and you're done. Dental veneers absolutely require special care. I would say as much, if not more, than your natural teeth, because it is something that's added to your teeth surface. So the area where the veneer and the teeth meet, that area, that margin must be kept very, very clean, okay? So that way there is no chance of bacteria to grow in between there, creating a secondary cavity growing underneath. So brushing, flossing, and mouthwash would help enhance and increase the longevity of these veneers. I always say to my patients, if you take care of your veneers as you should, brushing twice a day, flossing once a day, visiting the dentist for your cleanings based on your frequency visits, you should last, your veneers, your porcelain veneers should last 10 years. Composite veneers, I always say about 5, just due to the nature of the veneers. Have I seen both of them last longer? Yes. Everybody is very different. Everybody's diet is different. Everybody's health is different. So all of those factors go into that consideration of how long the veneers last. But generally speaking, they do last a long time. The cost of dental veneers varies depending on the number of teeth you want to veneer. Some people just veneer 4 teeth, some people go ahead with 8 teeth, some people go with 10 teeth, and some people go with the full arch. So it really depends on what look you're going for. It also depends on the material. So whether it's going to be composite or whether it's going to be porcelain, that also is factored into the cost of the treatment. As far as dental financing goes, we have multiple dental financing options to help our patients get the veneers that they're looking for, and that equates to low monthly payments, and that really works well for our patients. Dental veneers generally is considered a cosmetic procedure, and insurance companies do not pay for any cosmetic work. So generally speaking, they don't cover dental veneers. However, if you have an insurance, we may be able to give you a discount depending on the fees and depending on the insurance that you have. In order to schedule an appointment for dental veneers, you can just simply call us or you can book online. Our cosmetic consultation for veneers is $99, and what that includes is a digital scan. It'll include a cone beam scan, and we'll give you a before and after smile simulation of what your dental veneers may look like. I hope I was able to answer some of the most commonly asked questions regarding dental veneers. If you have any additional questions, or if some of your questions were not answered, feel free to give us a call at 954-578-6869, and we're here to help.